Drug resistance is the reduction in effectiveness of a drug in curing a disease or condition. The organism bacteria, virus, parasite, fungus becomes less sensitive or completely unresponsive to a drug that was previously effective. Drug resistance, also known as antimicrobial resistance (AMR), occurs when microorganisms like bacteria, viruses, fungi, and parasites evolve and no longer respond to drugs that were previously effective. This means that medications that used to be able to treat infections or cancers become less effective or even ineffective. Drug resistance arises from mutations that occur naturally in the genetic material of microorganisms. These mutations can change the way a microorganism interacts with a drug, making it less vulnerable to the drug's effects. Impact. The development of drug resistance can have significant consequences. Infections become more difficult to treat, requiring longer hospital stays, higher costs, and increased risk of complications. The spread of infections is more likely, especially in hospitals and other healthcare settings where individuals with weakened immune systems are more vulnerable. Certain cancer treatments may fail if drug resistance develops. Factors that contribute to drug resistance: overuse of antibiotics and other antimicrobial medications, inadequate compliance with treatment regimens, poor infection control practices, rapid spread of resistant organisms through travel. Examples: antibiotic resistance, bacteria becoming resistant to antibiotics, making infections harder to treat with common medications. Antiviral resistance, viruses like HIV can develop resistance to antiviral drugs, leading to treatment failure. Antifungal resistance, fungi can also develop resistance to antifungal medications. Addressing drug resistance: promoting responsible use of antimicrobials, including appropriate prescribing practices and patient education. Improving infection control measures in healthcare settings. Developing new drugs and treatment strategies to combat resistant strains. Conducting research to better understand the mechanisms of drug resistance and identify ways to overcome it. Types of drug resistance: antibiotic resistance, bacteria, for example, Staphylococcus aureus, E. coli. Antiviral resistance, viruses, for example, HIV, influenza, hepatitis B/C. Antifungal resistance, fungi, for example, Candida auris, Aspergillus. Antiparasitic resistance, parasites, for example, Plasmodium falciparum, Leishmania, Trypanosoma. 2. How does drug resistance develop? Organisms evolve resistance via genetic mutations. Selection pressure drugs kill susceptible organisms, resistant ones survive. Horizontal gene transfer in bacteria. Biofilm formation in bacteria and fungi providing protective environments. In viruses like HIV or hepatitis C, rapid mutation rates lead to quick evolution of resistant strains. 3. Key drivers of drug resistance: overuse, misuse of drugs in humans, animals, and agriculture. Poor adherence to treatment, for example, missing doses in TB or HIV. Inadequate diagnostic testing. Substandard or counterfeit medications. Lack of access to quality health care. Travel and migration spreading resistant strains. Use of broad-spectrum drugs when not necessary. 4. Drug resistance across different pathogens. A. Bacterial resistance. MRSA methicillin-resistant Staph aureus. MDR-TB and XDR-TB Mycobacterium tuberculosis. VRE vancomycin-resistant Enterococci. CRE carbapenem-resistant Enterobacterius. B. Viral resistance. HIV, resistance to ART antiretrovirals, especially when adherence is poor. Influenza, resistance to neuraminidase inhibitors, for example, oseltamivir. Hepatitis B/C, resistance to antiviral drugs, for example, lamivudine. C. Parasitic resistance. Malaria, resistance to chloroquine, artemisinin. Leishmaniasis and trypanosomiasis, resistance to pentavalent antimonials and other therapies. D. Fungal resistance. Candida auris, multi-drug resistant, hospital outbreaks. Aspergillus, resistance to azoles, for example, itraconazole. 5. Impact of drug resistance on patients. Treatment failure, higher morbidity and mortality, recurrent infections, prolonged illness and disability. On healthcare systems, increased healthcare costs, prolonged hospitalizations, greater burden on ICUs, more complex and expensive treatment regimens. On public health, epidemic outbreaks of resistant diseases, threat to gains in HIV, TB, malaria control, jeopardized surgical procedures and immunosuppression treatments. 6. Global threat and economic impact. 700,000 annual deaths from drug-resistant infections. 2020 est projected to cause 10 million deaths year by 2050 without action, costing global economy $100 trillion in cumulative GDP losses. Affects progress on universal health coverage UHC and SDG 3. 7. Combating drug resistance. A. Stewardship programs, judicious drug use, treatment guidelines adherence, dose optimization and de-escalation. B. Diagnostics and surveillance, rapid diagnostics to guide therapy. Surveillance systems, for example, GLASS WHO Global AMR Surveillance System. C. Research and innovation, new drug development, alternatives like phage therapy, immunotherapy, nanotechnology, AI for drug repurposing. D. Public education, behavior change communication, awareness of finishing treatments and avoiding self-medication. E. One Health approach, integrating human, animal, and environmental health, monitoring drug use in livestock and agriculture. 8. Policy and global action. WHO Global Action Plan on AMR 2015. Framework for nations to combat resistance. National action plans, NAPs, country-specific responses. International collaborations, GARP, REACT, Fleming Fund. Regulatory reforms, stricter antibiotic sales, agricultural regulations. If you'd like, I can turn this into a YouTube video script, a PowerPoint presentation, an infographic, or an educational article for the public or professionals.
Subscribe and follow My Health by Dr. J for more health videos.